Hey, you guys. Happy Tuesday. Come on in here. Come on in here. We're super excited to have you join us tonight. So give me a few minutes. When you pop in, say, hey, let us know where you are tuning in from. We want to connect with you. We want to know that you're in the building with us. Dr. Dunn, give me a second. I'm just going to do a little bit of housekeeping. I'm super excited. Look, you're just so pretty. Okay, so you look beautiful. You look
Thank you.
beautiful.
So do you.
Thank you. I'm excited to have you on tonight. Listen, we are touching on a topic that is so important, Dr. Dunn, and just so not talked about. So we want to break the stigma. We want to break the silence. And so we're going to do this together tonight.
Absolutely.
All right, so you guys, this is Lisa Alexander, founder and executive director of Stand Up Survivor. Super excited that, hey, from Tennessee, from Ohio, super excited that you've chosen to join us tonight. I am joined by the beautiful Dr. Andrea Dunn. She is the founder and executive director of Let's Be Hive, and she is also a doctor of pharmacy. Hey, Dr. Dunn, how are you?
Hey, I'm doing great. How are you?
I am wonderful. Thanks so much for joining me tonight. I'm so glad that you are here. Can you hear me? You're freezing out. Can you hear me?
Yes, I'm
Okay,
excited
good,
to
good,
be
good.
here. Thank you so much for having me.
Yeah, I'm excited. Listen, you guys, we have got some really good information for you tonight. And if it's not for you, it's for someone you know. And our goal is to definitely bring awareness to domestic violence and all the different facets of it. Hey, let us know where you're tuning in from. Okay, Dr. Dunn, so tell us a little bit about yourself and the Let's Be Hive organization.
Yes, I founded Let's Be Hive 5 years ago. And one of the reasons why I wanted to start this organization was because there's always been a really big need for HIV and lack of knowledge. There's always like a collaboration between, oh, well, we didn't know about it. We didn't know about it. We didn't know about it. And so it was always like a lack of education. So I have a background, I have a bachelor's in health education. And when I graduated, prior to graduating my fourth year of undergrad at University of Florida, I was selected to do an internship at the Florida AIDS and Education Training Center that was located at that campus at that time. They're no longer located there, but however, that was my first introduction into HIV and educating healthcare professionals on it. And I did a lot of research and was partnered with a pharmacist there and a physician and a whole medical team. And I just absolutely fell in love with the knowledge of HIV medications and how they were able to prevent mother to child transmission and just the advances of medicine at that time. I was just blown away. And that was one of the reasons why I went to pharmacy school. So I've always had a passion for antiretrovirals and medicine and more specifically related to infectious disease and critical care. And went to pharmacy school and just continued that passion throughout. So Let's Be Hive was actually born during my years at Howard University. And when I was in pharmacy school, and it was a project that I had to do with a group. And I pretty much took the lead on that project so we could do Let's Be Hive. And that was my way of combining my passion for health education with pharmacy and with like community outreach. And that's, ever since I had to put it on hold for a while because I had to get through pharmacy school and residency training and everything. But once I returned home after maybe about 6 or 7 years of practice, it seemed like no matter where I was geographically, HIV was always most prevalent in our community. And I saw a lot of children born to mothers and families who were HIV positive. And during my time in Washington, D.C., it was very prevalent there. And Georgia, Connecticut, Jacksonville, here in Orlando. I've just kind of traveled around a lot of places, and it was something consistent throughout, no matter where I was. And I really wanted to do something more to help. And I specialized in pediatric pharmacy. So my passion with integrating youth and children into our mission was very important to me because a lot of youth are often missed and they are one of the highest risk populations. So that's a little bit about me and where Let's Be Hive came from. And this is home for me.
That's interesting that you talk about some of the high risk rates of youth, because I know growing up, we heard about HIV. HIV was a big thing. And I feel
Mm-hmm.
like, Dr. Dunn, as time has gone on, it's not so talked about so much. And so, you kind of feel like out of sight, out of mind. But it's still very prevalent, because I know one of the
Absolutely.
stats for even Orlando, where we both are. I see y'all in Florida. Hey, you guys over there. So what's the statistic here alone in Florida?
The state
Or is
of
it pretty
Florida
low?
is currently ranked number 2 in the country. We've kind of teetered between number 1 and number 2 between us and California.
For
So for the
HIV?
last, yes,
Wow.
for new HIV diagnosis, yes.
Wow.
So currently we're ranked number 2 in the country. And then when you look at all the cities within the United States, Orlando ranks number 5 for the highest city in this Orlando metropolitan area. So last year, based on 2017 data, we were ranked number 3 previously, and we've kind of teetered between number 3 and number 5 over the last 3 to 5 years. We keep changing. So it's definitely something. I mean, people don't think of Orlando being a place of or a city that's high for new diagnosis, but it is. It's a lot more going on here than just going to Disney World and Universal Studios, and we have a
Right.
high rate of trafficking here as well.
We
And
do.
so it's all kind of hand in hand with everything that we're going to discuss today.
Well, and that's crazy. So of course, oop, I feel kind of like an echo. So oftentimes people think like Orlando, Disney World, but they're not thinking trafficking. They're not thinking high rates of HIV, and that's why these conversations I think are so very, very important. And
Yes,
so Dr. Dunn actually spoke at our fundraiser last year, and she spoke to us about the correlation between domestic violence and HIV. And oftentimes people don't think that there's a correlation, but there is a correlation between the two.
absolutely. There's a very high risk, especially for women. So I don't want to leave our men out because men also do suffer from intimate partner violence as well. But, for the sake of pretty much what we're going to talk about today, will be focused on women because I know that's your focus as well. But absolutely, intimate partner violence, women who experience violence in their relationships, they're at a 4 to 5 times risk at higher risk of contracting HIV compared to someone who's not. So when you look at the female population in general, 87%, 86 to 87% of heterosexual women are currently living with HIV, and heterosexual contact is the most common mode of transmission. And I
Wow.
think that's very important for women to understand because oftentimes we rely so much on our partners and we have this false sense of hope or a false sense of reality that we think that we're okay because or that their partner is okay because they're okay, or they may be going to the doctor, but their partner isn't,
Mhm.
or really high rates too of infidelities, condomless sex, and oftentimes it can also happen within marriages too, and monogamous relationships. So a lot of women who are living with HIV, it doesn't necessarily mean that they're promiscuous. It doesn't mean that they are on drugs. They can be normal, healthy women, or they can be involved in high risk situations such as intimate partner violence relationships that puts them at a 4 to 5 times risk greater than someone who's not.
Wow.
So right now, the CDC, they have a statistic for more specifically African American women that there's a lifetime risk. So for 1 in every 48 women, just without intimate partner violence relationships, there's a 1 in 48 African American women that have a lifetime risk of acquiring HIV during their lifetime. And that is based on the rates continuing to increase. If they maintain at the rates that they are right now, that is what is predicted. 1 in every 48 African American women. And it's even higher with as well as Hispanic women or women of color. We
I
and
saw that.
even
Higher.
Caucasian women, yes, but definitely women of color are at a highest risk. more
Why is that?
specifically African American women. And a lot of people ask this question, Lisa. And, one of the most common reasons is not being tested,
Okay.
not knowing their status. It's right now estimated that 1 in 7 people are living with HIV and they don't know it. And they can unknowingly spread the disease that way. So if they're not tested or they're not aware of their status, that's the number one risk factor right now.
One
And
in seven.
so,
That's a really high number.
yes, that's
And they
extremely
don't
high.
have it. And of course, they're just going around having intercourse with other people and they're spreading it because they don't know they have it.
hmm And then when you
Wow.
look at the race, some people, there's nothing wrong with interracial dating or anything like that, but you have to look at the populations. And so if the African American community or the Hispanic community just date our own and we stay within our race, then if it's higher in the African American population, it's going to remain higher in that population if we continue to just date the same race. And that's the same thing that takes place for the Hispanic population or even Caucasians for that matter.
Mm-hmm.
And I also think that another risk factor is a lot of our men may be incarcerated. And I think that that's definitely a correlation to the African American community. If we have men or women going in and out, there's a high risk also with that. So there's a lot of socioeconomical factors that we have to look at. Like you mentioned, we don't talk about it enough, especially in schools. So lack of comprehensive sex education, there's a lot of reasons why, but lack of condom use. There's no form of protection.
Yeah, and I feel like because sorry guys if you hear that echo. I feel like because people think, hold on, it's still there. If we don't talk about it, it somehow goes away. And that's just not a fact. It doesn't go away. It's just simply not talked about. And I think it's similar with like domestic violence. It could be happening right next door to you. And just because you don't talk about it doesn't mean that it's not happening. And
Absolutely.
and for those numbers to be so high, but then I think you said it's 5 times likely if there's abuse within a relationship for HIV to be present. One thing that's really important I think for our listeners too is to recognize that, hey, I see y'all, hey Donna, hey Cami, is that the rape within a relationship, a domestic
Mhm.
violence partnership, it often occurs. It's something that's not talked about either. You can rape
Yep.
a spouse. Forced rape does happen within a married relationship, and that is also an increased risk of HIV as well, because that's one of the
hmm
research I saw when I was looking it up.
Absolutely. And even when you think about domestic violence or intimate partner relationships or intimate partner violence, a lot of times women who are in these relationships, they don't really have so much say so with condom negotiation. There's no such thing if their partner does not allow that and they don't have a choice. And if there's infidelity, involved in that relationship and there's no condom use, that puts them at a higher risk of contracting HIV and sexually transmitted infections.
Mm-hmm.
And then also, if you contract or if you have another STI, such as chlamydia, gonorrhea, or herpes, that puts you at an even higher risk
Mm-hmm.
for HIV. So, having a prior history of an STI or a sexually transmitted infection can put you at a higher risk as well. So that history of your sexual history also plays a part. And so most
STI,
women, yes.
STI same thing or different?
So there's been a change or a shift from actually using the term sexually transmitted disease, which is an STD, and changing disease to infection. So a
Okay.
lot of times people are still interchangeably using these terms. However, STI is the more formal acronym that we should be using. So, sexually transmitted infection basically just means that we can treat it and it can go away, and not all infections are necessarily diseases. And so, there are some infections that can be curable, can be treated, and then other ones, that cannot. So, such as herpes and HIV,
Okay. Okay.
those are not curable.
Somebody's trying to get in contact with somebody.
I see
Sweetheart,
that, and I'm so sorry.
it's totally fine. It's totally fine. So as we were, we're going to discuss this. Okay, they say my audio is echoing. I know. Is it still echoing? Let me know, because
Oh,
if I sound crazy, let me know, because I want y'all to hear what we're talking about here. So somebody tell me, get in the comments if I'm still echoing, please. And I know one of the things that when I was doing kind of preparing for tonight, I saw that one of the fears that abusers use in the relationship is that if I have HIV or if I have an STD, they use that against me, and instead of moving on to another relationship, no one else is going to want you. They said it's good now. Thank you for letting me know. No one else is going to want you now that you have HIV or STI. No one's going to want to deal with you, and that's a fear. So they end up staying in the relationship, a fear of not wanting to move on. So can we talk about that? So say if someone is living with an STI or HIV, they can move on from this relationship, Dr. Dunn. We don't want anybody to live in abuse, but don't stay just
absolutely.
because you're experiencing an STI or HIV.
Yes, I think this is a very good point because with the advances of medicine, a lot of people who are living with HIV can still find love, still can get married and have babies and still have healthy relationships. You don't necessarily have to stay in an abusive relationship because of your status. You may experience challenges, however, you don't have to necessarily stay in those type of challenges, and that there's actually a statistic that shows women who are in intimate partner violence relationships and that are HIV positive, that they have a higher rate of depression. And so that's one of the links to why they may tend to stay there and have those internal feelings and deal with internal stigmas that no one is going to, want to be with them, and they do tend to stay. Um, but like I said, that's not necessarily true. So a lot of times in these relationships, people can be knowingly infected
Mm-hmm.
by their perpetrator or by their partner to try to force or coerce them to stay in that relationship with them. So that can definitely happen as before, transmission occurs, that they
And I
can
know I've
knowingly
heard.
infect.
Is
Yes,
there an echo? Hold on, let me let the echo calm down. So I've heard about that, Dr. Dunn, that survivors that we've worked with who have shared that they have contracted SID or they were forcibly given one because it was a way of power and control for them to stay in
absolutely.
to make them stay in the relationship. And I love what you just said. And for those that are watching and will watch by the replay, understand this: HIV, STD, it doesn't matter. You do not deserve to be abused. You don't have to stay in the relationship just because of it. Dr. Dunn literally just shared that you can live a great life with it. You will have challenges. We're not saying you won't have challenges, but you won't have the challenge of verbal and physical abuse,
It's
financial
a
and spiritual
process.
abuse. Yeah, it's a
Absolutely. It's
process.
a huge process that you have to go through to try and combat that stigma. And we actually have a Stinging Stigma empowerment program that we have this year for women and youth specifically who are living with HIV, for us to help combat internal and external stigmas, to help build them up and give them reassurance and affirming their life and helping them to develop self-love. And I think you have to go through a process before you can truly get to a point to where you're either ready to leave that situation or you have enough confidence and enough support to exit that situation beforehand. The good news is that other sexually transmitted diseases such as chlamydia, gonorrhea, syphilis, um, trick, or some people that's the nickname for trichomonas or trichomoniasis, and that is also those are all treatable. So as long as you get into care, or if you have any symptoms, and this is also another barrier with sexually transmitted infections and having complications when you're in a domestic violence relationship, is because you may not be allowed to go to a healthcare provider. You may not be allowed to receive treatment. And that is something that can perpetuate and lead to further complications if you have untreated sexually transmitted infections, including HIV.
Yeah, I was thinking about that because my echo, I'm like hearing myself. Maybe if you turn your speaker down a little bit, that might help. I'm not sure. Maybe a little bit. Can you still hear me?
All right, let
Okay.
me try.
Okay. So I was reading earlier too that if you don't get treated, I think especially now during COVID-19, when they may not have access to doctors as prevalent as they did before. And also, they're doing virtual appointments similar, and so you're not able to reveal really what's going on inside your home because of the virtual. But I know that problems getting pregnant, problems while pregnant, while not because of not treating the STIs and infections, reproductive problems. And so stuff like that can occur if you do not get it treated. And
Mm-hmm.
I saw that sometimes they, like you said, they will prevent you from getting the help that you need in
Mm-hmm.
order to continue to control you.
To control that behavior. And then when you think of even with reproductive coercion, even affecting with birth control, when women may not want pregnancies and you have a lot of unwanted or unintended pregnancies and they're forced to have babies even though they don't want to against their will. And that's another form of control when it comes to a woman and her reproductive health, that some women continue to have babies because they don't have a choice when they're in that situation, when their perpetrator pressures them to have a baby and they may
Let's
not want to.
Here it is. Let's talk about that a little bit too, because I know that sometimes some of the things they do is like make holes in the condoms or refuse them to allow to get birth control. So, what are some of the other things that you've seen with the reproductive coercion that really affects women? Like, because the truth is maybe they don't want to have a baby. I remember in
Mm-hmm.
a relationship, I thought, I wanted to have a daughter. I had her, and I was like, oh my goodness, this is wonderful. And then I was like, I got pregnant 4 months later, and I said, oh my God, I can't leave now. I thought to myself, what
Yeah.
am I going to do? Because I knew that I didn't want to have any more children, not with him, not in this situation, but here I was pregnant again, and it's like you want to at least be able to control it because maybe you have the hope of leaving. And they say, well, no one's going to want you. You have all these children. So you really are in this position where you don't want them to control your birth control. I mean, I even read that they try to take out contraceptives, rip off the patch.
Patches, yep, breaking birth control, hiding birth control, just preventing it, like tearing it up, damaging it, so that way you don't have access to it. So if you take pills, that's very easy to access. And so one of the interventions that healthcare professionals can do, according to the American College of Obstetricians and Gynecologists, they can actually cut the string a little bit higher for IUDs if you do have an IUD placement. So that way you can help prevent your partner from pulling it out or even noticing that something is there. That's actually one of the things that's recommended for women who are in these situations and you don't want a pregnancy and your partner is forcing you or pressuring you to have a baby against your will. And so a lot of times they will not pull out using, because that's a form of contraception as well, and they will also monitor and look at your menstruation and know when you are like learning and understanding your cycle, so that way they can know when it's the best time to try and impregnate you. And that's another thing. They won't pull out, or they may let you think that they did before they truly had a orgasm
And
to try
it's
and trap you.
all about the control aspect. I'm echoing again. It's all about the control aspect because they want to continue to control you. And of course, if you're home pregnant, then you can't leave because then what are you going to do? They may be the sole breadwinner or whatever the case may be. Or if you have enough children, they may think they can control you enough so you don't have to leave. And I
Absolutely.
know that one of the things, the coercive behaviors was like forcing their partner to have sex, threatening to end a relationship if they don't have sex. And oftentimes in some of these relationships, as the abuser is, having an affair or sleeping with someone else, but yet they're coming back into the
Back to you.
relationship and could be spreading those infections, HIV, STIs back into the relationship. And so
Hmm.
you're at a heightened level of risk, as statistics show, because of things like this.
Absolutely. And, even with healthcare professionals trying to conceal birth control or conceal, there's actually a HIV prevention pill, and it is called PrEP. That's like the nickname that a lot of people used to saying it, but it's a category of medications that are used to help with prevention. And I think this is so empowering, especially for women, because this is the first um, form of prevention that you can actually truly have control over without having to rely on another partner. And it's very similar to birth control, where it's a once a day medication called Truvada that women can take once a day. in high risk situations like this. Um, and I think that that's really important for women who are involved in domestic violence relationships and they may not know how to get out at this time, that knowing that there is an option available for you. And right now in the state of Florida, at all health departments, they are offering free PrEP to individuals who qualify. And I think this is a resource that's very important for everyone to know about. If you are in a high risk situation where you are engaging in condomless sex and your partner may have HIV, or you may feel like you're at risk of HIV because of infidelities or because of multiple partners, or even being forced to have sex with multiple partners. I think it's very important for you to know that there is a tool out there that can help you prevent it. And if taken PrEP appropriately, once a day, every day, it can reduce your risk of transmission for HIV up to more than 90% effective.
Wow.
So it's very, very effective at reducing it. And this is actually one of the tools that a lot of right now, PrEP uptake among Caucasian homosexual populations, this is one of the reasons why their rates have been able to come down over the last couple of years, because they've taken advantage of this tool. And a lot of people of color are not on the bandwagon, or just people who are the highest at risk. And there's definitely a lot lower uptake of PrEP among women. And that's one of the initiatives that we are trying to do here at Let's Beehive, is help women understand that PrEP is a tool for you too. And with 87% of women, being at risk for heterosexual transmission of HIV, it's very important for you to know that this is a tool for you. Even
That's a
right
really
now
big
in Orange
deal.
County, what'd you
I'm sorry.
say?
That's a really big deal. Hold on, I'm still echoing. Let me wait. I was saying that's a really big deal, that that is an opportunity for them. It's PrEP, PrEP, right? I wanted to put it down in the
PrEP.
comments. Okay, PrEP. And that helps prevent HIV up to a 90% rate.
Yes.
I mean, that
And
is
it's
huge.
at your control. It's the first HIV prevention tool. So, with condoms, you have to rely on your partner to wear them, whether it's a
Right.
female or male condom. You still have to rely on that being something that two people agree upon before that prevention tool can be used. In domestic violence, you may not have the option to be abstinent. So even though that's a form of prevention, it doesn't work in this situation. So for women who are involved in domestic violence, PrEP could be a tool to help prevent you from contracting HIV or being diagnosed with HIV in such a high risk situation. Um,
Oh,
and it
wow.
takes up to 21 days. 21 to, some literature says up to 26 days, but it takes longer for women to take it before they truly have protection in their vaginal secretions in their vaginal area. So that's really important. And it's a once a day regimen that you can take. And there's a lot of research going on now to try to see what they can do to develop different formulations of it. So one another recommendation to help with unintended pregnancies is like depot shot. That's a birth control that you can just get a shot and it lasts, over an extended period of time without anyone knowing that you are on birth control to help reduce unintended pregnancies. Well, a lot of the PrEP interventions that a lot of the manufacturers are working on now is developing injectable PrEPs in order to help people just be able to get an injection so they don't have to rely on taking a pill every day. So a lot of the strategies that they're using for PrEP mimics a lot of the same strategies for oral contraceptives to prevent pregnancy, and it can help prevent it before it occurs. And so this is something that I'm excited about, the opportunities to really help women get on this prevention pill. So if there's anyone out there who is interested in learning more about PrEP, no matter where you're located, definitely reach out to Lisa. You can definitely reach out to Let's Beehive, and we'd be more than happy. We do PrEP referrals as well as free condom distribution. for anybody who may need those forms of prevention. And we also do referrals for HIV testing.
So that's
And
sorry.
letsbehive.org.
.org. Okay. So I want to make
Dot
sure we
org.
put this information up. I'm sorry to interrupt you, but that people can see it, because I think one of the biggest, well, you know, that one of the biggest things with those who are experiencing domestic violence is that they don't have the power and control over their own life. But with this PrEP pill, it gives them the control back over their life and protecting themselves for things such as HIV. And so I think this pill is very, very empowering, and it puts that control back into your hand. You may not be able to stop the rape, you may not be able to stop, them forcing you from intercourse with others or whatever the case may be, but you can help to prevent yourself from HIV. So I'm putting Dr. Dunn's website up there. She said that you can reach out to her because, okay, I wanted to ask. You said that they're giving it out in the state of Florida. Is that right?
Every health department in the state of Florida has a PrEP program.
Okay.
And as long as you meet eligibility criteria, you can get PrEP for free. So for people who are in high risk situations, even as something as simple as where you live and being in a geographical location, that can give you, you would be a candidate for PrEP. And I think that's really important, especially for example, just living here in Florida, in the state of Florida. If you're in Miami, Fort Lauderdale, West Palm Beach, Orlando, even if you're in Atlanta, Baton Rouge, Louisiana, Houston, Texas, no matter, I see that there's somebody, I think Texas, from Texas that was in the chat, but
Yeah.
you know, I mean, no matter where you are, there's different state policies, but because the state of Florida has been ranked so high, we've been number one for years for the highest rates of new HIV infection. So it's a statewide initiative that has been used to help increase access to PrEP. One thing that a lot of people aren't aware that this prevention pill even exists. And that's another factor that, at Let's Beehive with pushing education, that's one of our initiatives to help people learn and understand and know about it. And then, there's some side effects to PrEP just as well as, any other medication that you take, but there's a lot of side effects to birth control and
There are.
other medications too, but it's something that you have to think about when you're looking at the risk versus benefit. Would you rather take a pill every day to try to reduce your risk in a situation if you're not ready to leave yet, or you're still in transition, or you're still seeking help to figure out what you can do? PrEP is definitely something that you should look into.
And I loved Dr. Dunn that I love Dr. Dunn that you guys are big on education. If you guys have any questions, please feel free to put in the comments or inbox us. I know this is a sensitive topic, but education is key. And I know that with Let's Be Hive, it's about education. We don't know, so we just continue on in the cycle. I mean, and so I think that's one of the biggest things that you guys do is educate. Because if we're educated, we can change something.
Absolutely.
And we know that as victims of victims and survivors of domestic violence, we're exposed to a lot of things that we may never ever say out of our mouth. But I love this conversation specifically, I think, because we're giving them the opportunity to be educated on how to protect themselves from sexual transmitted infections, reproductive coercion. But I wanted to touch on that really quickly. Let's talk a little about reproductive coercion real quick, because I know that it has a lot to, like, sabotaging birth control, trying to force pregnancies and things like that. I don't know if you had anything else you wanted to touch on with that, but we talked about like not pulling out, poking holes in condoms, trying to make sure that they're pregnant. If you don't get pregnant, I'm going to leave, or so say for example, someone knows a relationship with does not want to carry the child to term, they force them to. So there's a lot of coercion that goes on in that.
Yes, there's also higher rates of abortion because of this, or women who are seeking abortion because of potentially maybe being HIV positive, or not wanting the pregnancy and they want to terminate, and they may try to do that secretly without their partners knowing. And so that's another factor that we have to also, think about with women who are in these situations, and maybe some of the reasons why they're seeking abortion. It may not necessarily mean that they want to do, but they may feel forced to
Yeah.
do something like that. So
And I
with
think
reproductive,
sorry, with the abortion too, it's like on one side you don't want to, you may not want to have another child with this abuser because you know that you'll be forever stuck, or they're abusive to you, they may be abusive to the child or whatever. Or on the other hand, you may be forced to have an abortion, from the abuser. So I think with that, it goes both ways. And so anyway, sorry, I didn't mean to interrupt, but go ahead.
no, no, you're good. I
I
love
just
it. I love the
I just love
question.
giving them the information, because if they have the knowledge, then they're equipped to do something about that knowledge. And we want you to protect yourself from the different STIs, and from HIV, because we don't sometimes, we don't know what they're doing. We don't know what the abuser is doing, but we want to make sure that you are able to gain some kind of
Yeah.
power and control over your own body, um, and over your own life.
I think one thing to think about too, they state that either intimate partner violence can either be not only a risk factor for HIV, but it can also be a consequence or the cause of why someone is HIV positive. When you think about rape and the sex trafficking and things that can go on that you're forced to do against your will. And I think for women or just people in general, abuse can happen even after disclosure. So there's statistics that show that up to 4% of people who disclose their status, that they may be HIV positive, they tend to experience more intimate partner violence than anybody else who may not be HIV positive. And so that's another fear and another stigma that a lot of people who are living with HIV are afraid of. They're in fear of furthering or having more violence, or that could be the cause or the start of the violence in a relationship when you disclose your status. And so that's something that I think a lot of people don't talk about
Mhm.
as well, considering if this is your only partner and this is the person you're with, and then you come to them that, hey, I have XYZ, and then it creates more problems than it does than helping and solving it. And so I think it perpetuates that silence, and it perpetuates the fear, and it perpetuates the reasons why people stay. And I just want to really encourage anybody who's out there listening today to definitely reach out to Stand Up Survivor, reach out to Let's Beehive, anyone, even in your local areas, because there are a lot of resources out there that a lot of organizations are doing to help to reduce this stigma, reduce the spread of HIV, reduce domestic violence. Just there's so much out there for people that are willing to try and help you. I know it's probably saturated, and I think with COVID, it's probably made things worse, especially when you look at the financial component of everything, or people who may have lost their jobs or things of that sort. So I just, really want to encourage people to reach out and to communicate as much as they can to the resources that are available, because there is help out there, and there is life beyond sexually transmitted diseases. There's life beyond abuse and being, feeling like you're stuck in a situation that you're really not. It's just a matter of that mindset and that's the process that you have to, get over. Not necessarily get over. I think that's the wrong word, but it's a process that you have to do to gradually um,
Move forward. Yeah.
move forward.
Yeah, I love how you said there's life beyond STDs, there's life beyond HIV. It is not the sentence, it may project it to you. Like before, HIV was like a death sentence. You're like, oh my goodness. That's just not the case anymore. And there's also ways for you to prevent it. So, Dr. Dunn, how can they get in contact with you? What is the Beehive doing? Tell us what you guys are doing so that people that are listening to you, they can reach out to you, because I know this is a sensitive topic. And I know I'm going to, in my inbox, people are going to be like, they have questions. So I want them, listen, contact the Beehive. They have a whole staff. They have team. They want to help you. They want to work with you, and they want to ensure that you are protected. If they can't, they will refer you to someone locally. But tell us what you're doing, Dr. Dunn, here in the community.
Yeah, so we last year, I will say, one of the things that we're doing is really trying to intersect HIV education in non-traditional settings. And I think we've done a really good job of collaborating with strategic partners to help increase awareness. And right now, with our Stinging Stigma empowerment program, that is where we are specifically helping women and youth who are living with HIV. So if anyone knows anyone who is in need of help, that is an anonymous virtual support group that we have. And we're actually coming up, I think it ends in November. But because it's virtual, everything, you have the ability to replay everything. So you can find a link to our Sting and Stigma program to request to join if you are living with HIV, if you're a woman or a youth. So that is one thing that we have been working really hard on this actually throughout COVID. And of course, our Queen Bee HIV prevention program, that's dedicated specifically to women and girls, where we do HIV prevention, education, and awareness.
Mhm.
And we also have a new community based program that's coming up, and it's called She is Prepalicious. And that is the program that we are going to be helping women increase uptake of PrEP. So that way we can get our numbers down and we can get HIV to zero, not only for women, but for all populations.
I love
So
that. She is
we just have
prepalicious.
a emphasis for the girls
I
because they're
love that.
often forgotten about. I think when PrEP first came around, a lot of people associated it for just homosexuals or gay men,
Mhm.
and there wasn't a lot of marketing for women, and so it just was assumed that it was only for that population. But it's PrEP is for everyone.
I
If
know too
you
that you guys are working with the church organizations, religious organizations to educate them on HIV as well, which is so important because again, we're talking about a sensitive topic. Sometimes churches, religious organizations don't want to go there, but you guys are getting into those areas and
We
doing
are
that.
inside churches, and I think it's really important too, Lisa. Thank you for reminding me on that because we actually have our next faith HIV education class for pastors and faith leaders coming up on this Saturday, actually October 24th, and we have a faith leader who leads that, and it's so exciting. Most times there's a lot of pastors and faith leaders who may not necessarily be equipped to handle when someone comes to them to disclose their status. And a lot of people who are in need or maybe in dark spaces may turn to faith based settings in order to help them. And I think it's so important and vital for faith organizations to be equipped with those resources to be able to help members within their congregation. And it's huge. And, honestly, there are a lot of pastors who do want to help. They may just not know how. And I think because of the faith aspect of it and things may be going against the Bible, and there's a lot of stigma even within faith-based settings, but there are a lot of pastors who understand the need, and they want to help in any way that they can. And I think one thing that has helped us is helping them understand that we're God placed us to love everyone.
Mhm.
And I think sometimes when it comes to HIV or any sexually related issues, whether it be rape, molestation, or even trafficking, it's just, a topic that's not really talked about. I mean, we may do vowed purities, and we've actually participated with a few churches to do STD education during that time. And I think that's great, but abstinence may not necessarily be the only way. And I think we have to equip our youth and equip our young adults as they transition from being a youth into adulthood. And in the church is a perfect setting where you can really reach a lot of people. And we've had great success. We are still working to partner with three churches by the end of this year. So if there's anybody in the Orlando area that may be watching, we are definitely still looking to build more faith-based partnerships. So
I love that,
the,
and I feel the same. Let me see if you guys now to feel the same way about domestic violence and the church and faith leaders, realizing that's the first place that oftentimes that they go. So when they come to you, what are you going to tell them?
And
When they
that may
come,
be the only safe space that they feel that they can go without being victimized or without being abused because they went to church. Like that could be a safe space for a
exactly.
lot of people who are dealing with domestic violence. And
And if you can't give them a pamphlet or direct them or show them what to do, you say, "Let's pray about it." Yes, but then what? My body is not well. I'm in danger at home. So making sure that those connections are there within the community with the faith-based leaders, HIV, domestic violence, those things are really important. We can't hush them, especially with young people. We'd like to say, "Oh, stay abstinent," but we also know we live in 2020 when a lot of times that's not happening. So what are we going to do? Not
exactly.
talk about it, or are we going
Mhm.
to educate them so that they can protect themselves? I think
There
that's
are a lot of women also in the church who may be experiencing these things and they don't know what to do. And I think a lot of times, even in within faith, sometimes that can be used against you and scriptures in the Bible, and they force you to, stay. And if you're even in a marriage, sometimes women who are in marriages are at a high risk as well because there's no condomless sex. And I think that's a misconception that well, I'm married, I don't have to worry about this. I'm married, I don't have to think about that. Oh, thank God I'm married, but that doesn't necessarily mean that marriage will keep you 100% safe, even though that's what it's intended to do.
right.
It may not be the reality of what things are. And I think there's a lot of women who are within the church that are high risk and may not even know it. And they're staying within their marriage thinking it's something they have to do because till death do us part,
Yeah.
and they stay in violent relationships or they stay in
Yeah.
abusive
And they're at
relationships.
risk. And like you said, four, what did you say, 4 or 5 times because of domestic more at risk. So that definitely puts them in a lot of danger. So I know that we were going to talk the Queen Bee HIV prevention program, and I know that Dr. Dunn and I are working on some things together to collaborate with domestic violence and HIV because we know that we see the obvious, and there's not a lot of research even. Dr. Dunn, if you look at it, there's not a lot of research on it, not with domestic violence and HIV correlation. And we want people to be educated and be aware. So did you want to
Mhm.
share anything else with anyone here about anything?
Yeah, I just wanted one, thank you for the opportunity to even come on and speak to your followers. I am so excited with everything that you're doing with Stand Up Survivor, and it has been a joy. Like, I was honored to even just have an opportunity to talk to your followers today and to have this interview with you. So, thank you for that. And I would like to say thank you to everyone who's listening. And I really hope that today was beneficial. And I really hope that you learned something today, and that, this will help you to have an eye-opening experience and know that even if you are in these situations, that you do have risk or opportunities and tools that can help you reduce your risk of contracting STDs, including HIV.
So if you have any questions, please make sure that you reach out to Dr. Dunn. I put her website here. What's your Facebook? Let's Be Hive.
Our Facebook is Let's Beehive.
Okay.
So it's www.facebook.com/letsbeehive.org.
Okay. Awesome.
And then our tags on Instagram as well as Twitter is at Let's Beehive.
Let's Be
A
Hive. You guys connect if you
lot
have
of
any
people send us
questions.
messages. Yeah, send us a message.
All right, awesome. Dr. Dunn, thank you so much for joining me. I don't know, my internet just acted weird just now, but thank you so much for joining me. I appreciate it so much. I love that that you choose to educate about something that's so important and collaborate with domestic violence, understanding the high risk that survivors experience. So remember, there is a PrEP pill that helps prevent against domestic violence. Contact the Beehive or contact your local health department in case you are in need of it. And we will see you later. Dr. Dunn, don't go.
Okay.
Say bye to them, okay?
Okay. Thank you.